What we want to offer is cost reduction, choice, security, and quality. President Obama and this Congress want to reduce health care costs, Mr. Speaker, and offer people a choice of doctors and plans and guarantee affordable quality health care for all. That's what we're trying to do. This is an American solution. You always hear people talking about, well, what they do in Canada, what they do in the UK, what they do in France. We're not talking about any of those countries. We're talking about a uniquely American solution. Not trying to be like anybody else, Mr. Speaker. The fact of the matter is 36 other countries in the world, and every industrialized country has national health insurance. We don't. That's why their outcomes are better and their costs are lower. But, Mr. Speaker, we're not talking about comparing ourselves to some other country. We're not talking about what other countries do. We're talking about an American solution that'll ensure every child in America is covered, that will invest in prevention and wellness, where we'll ensure that doctors and nurses get the information they need to provide individuals with the best care available. And never again will your coverage be denied because of a pre-existing condition or your age or your gender, or ending a system where profits become before people and millions go without vital health care. Never again should we make life or a job decision based on coverage. And never again should we let our families suffer financial catastrophe or bankruptcy because of these high costs. Mr. Speaker, I'm coming to the point where we're probably going to wind up in not too long. But I do just want to make a few more points before I take my seat. One of the things I want to do, Mr. Speaker, before we just take our seat, is just point out the fact that scare tactics and fear tactics have not served the American people well, not back in 1994 when health care was defeated then, and they won't work now. We've learned a lot since 1994, and we're not going for it, Mr. Speaker. Fact is, health care is a social imperative. It's an economic necessity. And the new study by the President's Council of Economic Advisors demonstrates that the current health care system is on an unsustainable path. Without reform, escalating health care insurance premiums will continue to cause American workers and families to experience eroding health care benefits and stagnating wages, while rising spending on health care and Medicaid will lead to massive, unsustainable federal budget deficit. The fact is, we need change. Just have a few more points to make, Mr. Speaker, and then I'll be able to hand it over to my colleagues on the other side of the aisle. And I don't know what they're talking about, but if they talk about health care, I want you to remember what I said, Mr. Speaker, because these facts are critical, and we cannot allow anyone to scare us away from the reform that is necessary today. The fact is, Mr. Speaker, the American people want change, and they're going to get change, and they're going to be much, much better for it. The fact is that we do need this public option. We do need health care reform. And as soon as I find what I was looking for, I'll tell the folks what I wanted to tell them. Oh, yeah, okay, well, here we go. Yep, got what I need. So, Mr. Speaker, as I was saying before, the fact is that we do need the change, and we can't allow it to be denied. It's time for the American people to raise their voice, Mr. Speaker, if they want to be heard.